Good morning and thank you for joining us on Thriving on the Suncoast. I want to wish everyone a very happy Passover and a happy Easter. You know, the holidays are going to be a little brighter for local seniors. Comfort Keepers Comforting Cards program has been growing every holiday since we started it last year. We've been providing elementary schools with blank cards so that they can write messages and decorate them for the holidays. And we distribute them to seniors throughout the community, such as nursing homes, through Meals on Wheels, Senior Friendship Center, through local nonprofits. And we're able to get them into the hands of seniors who often don't have anyone to spend the holidays with. The kids love it. It puts a big smile on the face of the recipients. So we're distributing close to almost 1,000 cards for Easter. A big thank you to all the schools and the kids for supporting this important program. Another great program we have, which connects our seniors with distant friends or family through our Grandpad program. You know, our clients will now have the ability through this simple tablet to push one button and connect through the internet with their loved ones. Imagine, with no technical skills needed. You can see and say goodnight to your grandkids every night. And it can do many other things. With a touch of a button, they can send or receive a text or a voice email, photographs from your kid's cell phone, listen to music, play games, or a one-button Skype phone call. Push the button, you're Skyping, talking to your family. Call Comfort Keepers if you'd like to try one of these out today. Today we're going to talk about how to get the most out of your healthcare professionals. No one discipline has all the answers. You can't be a specialist at everything. But if your healthcare team doesn't have the time to share or consult with each other, who's going to suffer? To give us some insight into these questions and more is Dr. Fred Harvey, the director of the Harvey Center for Integrative Medicine. Dr. Harvey has over 27 years of medical experience, including 16 years in functional medicine, holistic medicine, and he's triple board certified in internal medicine, geriatrics, and holistic medicine. Dr. Harvey, welcome back to the show.
Thanks, Michael.
You had a newsletter I saw that said, "No man is an island and it takes a village to handle the need." Village to handle the need of the clients. What is that? What did you mean by that saying?
Well, I think there's an old saying, it takes a village to raise a child, but it takes a village to heal also, because people are besieged by many things during an illness, and they need advice and help in changing some of those things that are going on, and no one practitioner has all those answers. And so it helps to have a group of people coaching someone along. Someone with diabetes needs some dietary advice. Someone with kidney failure could use some dietary advice. A person post-heart attack or stroke needs some physical therapy advice. And so we need these other modalities or other scopes of practice, specialties if you like, to help with healing an individual.
It seems like our whole way of doing medicine in this country has forced people into those segmented boxes, but I guess what you're saying is the problem is that there's not enough communication between those boxes. I mean, you hear the stories all the time about people going to doctors and getting different pills from each specialty, and then finally somebody looks at it and says, well, these medicines are interfering with the other one or canceling some of the benefits out. Do you see that as a problem with people that come to see you?
I do, and that's part of the concept here, that going to multiple medical specialists is not getting a collaborative team together. Multiple medical specialists are all medical doctors, or doctors of osteopathy, which is pretty much the same thing. When you just see doctors, you have a very narrow view of what health is about, because doctors focus on illness. And so they're not really using a set of tools that coach wellness. On the other hand, other modalities such as behavioral specialists, counselors and psychologists, acupuncture practitioners, dietitians and nutritionists, these people have different scopes of practice, different sets of knowledge, and different ways of approaching human health. And they tend to approach health and uplifting health rather than illness. So they work more in the realm of functional medicine like I work. Functional medicine being a growth out of the holistic and integrative medicine movement.
You know, you take a discipline like acupuncture that's been around for centuries, and
Millennia,
and has basically been the mode of treatment for, you know, Eastern civilizations, and yet you get here and it's like, I guess because of advertising, because of the big money machines, they don't want you, they sort of poo-poo those disciplines as being ineffective.
well, you know, there's a language barrier to some extent between contemporary medicine and holistic medicine or functional medicine, and that is allopathic medicine is extremely skilled at taking care of illness. Its whole focus is to describe illness, name the illness, look for the illness, diagnose the illness, and then blame the illness or the diagnosis for the illness, and then treat the symptoms of the diagnosis, rarely treating the root cause of the problem that caused this diagnosis. And so it's very illness-oriented, whereas many other modalities are wellness-oriented, and they look at the human body and the human condition and try to improve the human condition no matter what the label. And so to do that, you require a lot of collaborative care and collaboration between these different areas of concern.
Because of cost constraints, it seems like doctors have been pushed into very small time frames of being able to, you know, get to the bottom of problems and have the time to collaborate, it seems like.
Yes, in today's insurance-based market, it's very difficult to get the time to communicate. And so what really happens is the diagnosis is made and often a prescription is written and occasionally referral to another modality. What patients need to really understand is that doctors don't have all the answers. Doctors are very skilled at what they do and they're very valuable, but often the doctors get a little confused because the medicines are so powerful and the surgery often works very well that they don't really understand that this other group really is necessary. For someone who has a heart attack, yes, a stent will stop the heart attack and maybe spare some of the heart. But the emotional distress, the anxiety and depressive moods that come after a major life-threatening event like that are not addressed by any pill. Counseling is really important to help with the grief, because if somebody has a heart attack, they've had a loss. It's almost like they've died, but they haven't. And so they have this whole sense of, I'm not as whole as I once was, and they need behavioral therapy to help them with that, to get through that issue.
And there's a lot of deeper things that are caused by surgeries and things like that you can have aches and pains later in your life that you don't really know where they're coming from.
Right.
I know I've experienced some of those types of issues. Yeah. So we only have about 30 seconds left. It seems to me integrative medicine alludes to the fact of collaborative care.
Yes.
Integrative means looking at the big picture and sharing.
And integrating all kinds of information and tools to do the job.
Okay. Well, we've got to go to break and come back and find out how collaborative care will help you. Stay with us.
Is Mom really taking her medications?
A Comfort Keeper can ensure that your loved one gets their medications on time, providing peace of mind for families in need of flexible in-home care. Comfort Keepers, let our family take care of yours.
When a stroke or injury impacts your life, we're here to help you get it back. With our dedicated team of specialists, personalized treatment plans, the most inventive technologies, and a coordinated approach to recovery. This is more than just rehabilitation. This is a higher level of care.
Let's face it, life happens, and the laws change daily. Attorney Joseph Land can help guide you with legal issues you may face while aging. Len Law has helped countless clients in Sarasota and Port Charlotte in assistance with guardianships, Medicaid planning, VA planning, estate planning, wills and trusts, probate, and Social Security disability claims.
I'm elder law attorney Joseph Land. At Len Law, seniors matter. Your rights matter. And the legacy that you built matters.
The Harvey Center for Integrative Medicine is helping people every day to thrive and live healthy, vital lives. Our integrative approach combines conventional medicine with holistic and innovative therapies to help you achieve optimal function. Are you ready to function at 100% of your ability? Dr. Fred Harvey customizes tools and treatments to achieve optimal wellness at any age.
Hi, I'm Dr. Fred Harvey. Do you want to feel vital, vibrant, and fully energized? If so, call our office to find out how.
Welcome back, or if you're just joining us, I'm here with Dr. Fred Harvey. We're trying to discuss the concept of collaborative care and how it's going to help you have a better outcome in your health experience. Doc, where does this concept of collaborative care come from?
That originated in the 60s with some research, I believe, done by Kaiser Permanente and the federal government, looking at the impact of mental health in primary care. And what they found was probably 60% of all primary care office visits are driven by an emotional problem. And so the initiative at that point was to have several prepaid visits available at behavioral therapists for all clients within this system being studied at the time. What they found out was by having people have a few essentially free visits with these counselors, primary care visits dropped by 65%. People were dealing with their problems in a different way and realizing that some of their symptoms weren't that bad, that they actually really were having more emotional distress over issues, and they were able to work through them.
There certainly has been a lot of information written over the years. I don't think people give it enough credence about how much your mind controls your health, which is sort of what you're alluding to. People are having these in their head, they're having these problems, but they're not understanding how to deal with them correctly. In your practice, do you deal with that and help people realize that the power of their mind has a lot to do with their
Absolutely,
outcome?
that's a real big part of functional and integrative medicine because we look at that part of the system. One of the luxuries that I have and many integrative practitioners do have is that being outside of the insurance system, we're able to spend more time. So we have time to listen and hear what actual problems the patient is bringing rather than the 4-minute visit with just the ability to listen to some superficial symptoms. And so we can expand on that and give more direction. The interesting thing about the collaborative care initiative is it really focused on behavioral health. And once that first study came out, other insurance companies started doing more studies, and they found out that you can really contain costs by helping people deal with mood disorders and thought disorders. And so
certainly mental illness is a runaway cost. I mean, we don't even seem to know how to deal with it.
Well, that's because there's no such thing as mental illness.
Okay.
There's actually brain disease that causes mood disorder and thought disorder, but there's no such thing as mental illness. We can't think our way out of schizophrenia. We can't think our way out of psychosis, but we can treat the brain disease that causes those disorders. Depressive symptoms can come from a variety of areas, including a medical condition like diabetes. If your sugar metabolism is disarrayed, you might have mood disorder because your brain is not getting the right nutrients that it needs, so it can't run appropriately. And so that's another area of concern. That's why I think that the model of just collaborative care with behavioral health falls a bit short of what we really need.
You know, you mentioned the diabetes. There's probably a lot of things that are being messed up because of all the toxins in our system, screwing up our endocrine system, which has a huge impact on how our body functions and how you think, does it
Right.
not?
Yeah, so if you have a medical condition that causes low testosterone, you might have mood disorder and thought disorder. If you have a problem with your ovaries and you don't make enough progesterone, you can have terrible symptoms of perimenstrual syndrome or a terrible menopause with hot flashes. If we can balance those things, you could find differences. But another thing that was very interesting is the collaborative care model worked, and it was shown to work. And so the government again did more studies and created the Agency for Healthcare Quality and Research, and they collaborated with the American College of Physicians and other adult medicine groups and created something called the Patient-Centered Medical Home. And that is an integrative practice. They don't call it that, but they house a primary care doctor and a behavioral specialist in the same practice, so that patients have access right there then in that one home to take care of that issue. Again, I think that falls short of what we need. And that's why...
But it sounds like it was a start in the
Oh,
right
it's a great
direction.
start, absolutely.
And this was, are these available now? Or, I mean, what happened to that
Well, there
study?
are the patient-centered medical home is an active part of some medical practices. Most of them are insurance-based, insurance-driven, because it really does help in the 4-minute visit to have the ability to say, you sound like you have a mood disorder, go see our behavioral specialist and get that intervention right away. It's difficult to do it when you're in one office and the behavioral specialist is in another. It puts a little bit more of a barrier to the patient to get there. And the same thing goes for the dietitian. Because the dietitian is really critical in changing the course of health. There's studies with dietitians and nutritionists that show that you can change the course of chronic kidney disease and slow down the onset of dialysis needs. You can change the impact of diabetes in people's lives. And there's definitive studies that show that if you have visits with a nutritionist over the course of your dietary changes, that weight loss is more effective and more permanent. You actually achieve better results by talking with someone in that specialty to help you get through it. Because there are a zillion fad diets out there, and you can do them for 4 weeks and lose 10 pounds and then stop the diet and gain it all back. Why not talk to a specialist who can help you make a lifestyle change?
And I think what that speaks to is the fact that if your physician is pinpointing where the causes of the problems are coming from based on the symptoms, and then they work with the dietitian, there are many different types of diets that someone can be on. I was speaking to a dietitian the other day, and she's telling me how this diet that she's got people working with is people are losing weight like crazy and feeling a whole lot better.
Yes.
So, I mean, diet is the key to a lot of the disease process, is it not?
It is, very much so.
Yeah. So it helps, it's going to help with medical costs, and our medical costs in this country are just runaway.
Yes.
Yeah.
And one of the reasons for that is that rather than addressing root cause and having people make a change that prevents further deterioration, Western medicine, in its illness focus, basically chases the problem.
Yeah.
It's always behind it, and so it always costs more to catch up.
Let's go to break right now. Check out our sponsor. We'll be back to talk about collaborative care. Stay with us.
The Harvey Center for Integrative Medicine is helping people every day to thrive and live healthy, vital lives. Our integrative approach combines conventional medicine with holistic and innovative therapies to help you achieve optimal function. Are you ready to function at 100% of your ability? Dr. Fred Harvey customizes tools and treatments to achieve optimal wellness at any age.
Hi, I'm Dr. Fred Harvey. Do you want to feel vital, vibrant, and fully energized? If so, call our office to find out how.
With the help of Comfort Keepers, I'm keeping my mom healthy.
I'm keeping Dad on schedule.
I'm keeping my mom happy.
Comfort Keepers in-home professional caregivers can provide meal planning and preparation, health and wellness services, and personal care services through custom care plans that can change as needs change, so your aging loved ones can stay happy and healthy in their own home.
Comfort Keepers, keeping the comfort of home.
Let's face it, life happens, and the laws change daily. Attorney Joseph Land can help guide you with legal issues you may face while aging. Len Law has helped countless clients in Sarasota and Port Charlotte in assistance with guardianships, Medicaid planning, VA planning, estate planning, wills and trusts, probate, and Social Security disability claims.
I'm elder law attorney Joseph Land. At Len Law, seniors matter. Your rights matter. And the legacy that you built matters.
When a stroke or injury impacts your life, we're here to help you get it back. With our dedicated team of specialists, personalized treatment plans, the most inventive technologies, and a coordinated approach to recovery. This is more than just rehabilitation. This is a higher level of care.
Welcome back. I'm here with Dr. Fred Harvey. We're talking about collaborative care and how those models fit together for better results for your health. You mentioned patient-centered medical home, and I don't think we necessarily mean a separate home. You're talking about a home inside a practice?
Yes.
Okay. So let's talk about that a little bit more and how that's going to benefit people that are dealing with, some chronic health problems that are going on.
Well, as I mentioned, it's an access issue. Having the collaborator right there is very helpful. I don't have a patient-centered medical home. I haven't set it up that way. I'm not an insurance-driven practice, but I've had a variety of collaborative practitioners in the office in the past. And currently, I have a functional nutritionist, and I've had acupuncture practitioners, massage therapists, colon therapists, a variety of different people that have worked in and through the office. And with a variety of successes, it was very difficult to convince anyone to use the colon therapist.
Well, you'd be surprised the results that those folks have.
Yeah,
it's one of those things
good.
that it's a modality that people don't even hear about that much, or if they hear about it, unless they know the benefits to them, I've heard some amazing stories.
Yes, and even when the benefits are explained, people are still squeamish about having that therapy, so they tend to avoid it. But it would be, I think, of benefit, though it's just never come to fruition, to have a behavioral therapist in the practice. In the insurance model, it was difficult for me to grasp it.
How's
Outside,
a
it's a
behavioral
little
therapist
easier.
different from a psychiatrist, for example?
Well, behavioral therapist includes psychiatry, but for the most part, psychiatrists don't do a lot of behavioral therapy. I mean, as far as and when I'm talking about behavioral, I'm talking about mental, emotional, behavioral, the whole ball of wax. So the psychiatrist and the psychiatric nurse practitioner are able to prescribe medications to treat mood disorder. And so they have a different ability and a different toolbox than the rest of the therapists, which include licensed mental health counselors, master's degree in science and social work, and psychologists, none of whom really have the ability to prescribe medication, but they have the ability to help people work through behavioral issues. And so part of fixing mood disorder is fixing thought disorder, because you can think lots of negative thoughts and disempower yourself from being able to do the things you need to do to be vibrant. If you say, I can't exercise, even though you can, and exercise cures depression. If you want to use the word cure, we know it dispels those mood problems. So if you inhibit your ability to exercise because of bad thinking, then you're not going to be able to surmount the problem. It's that kind of simplistic reduction of our cognitive, the way we think about it, behavioral issues. And so a cognitive behavioral therapist is a real ideal person to use while potentially using a medication like an antidepressant to treat some of the very bad mood feelings while you're going through the changes that nutrition and counseling and physical medicine can help too. So I think also to be able to have a practice big enough to include a physical therapist or a personal trainer to do physical medicine would be good. But there are enough gyms around with access in different neighborhoods that people can really access that themselves with direction. And you have to find the right therapist that understands what's going on to be able to do the right physical therapy for that person. So
I think
it's really
helpful
important
for a doctor to say, you need to get on a regimen of exercise and get started and go see someone, and they'll understand how to work with you with your limitations and your abilities to get you into something that's comfortable for you. But they have to get started, because it seems like the more money we throw at finding a pill to fix a disease process like dementia, the more they come around to saying, it's exercise and diet.
Yeah, we've been saying that forever.
And detoxification issues.
And one of the problems is that when the doctor has 4 minutes and the patient has the list of complaints, when it comes down to the prescription, doctors aren't really good at writing prescriptions for other things than medications. And so often a medication will come out. I have a patient that just went to a local weight loss clinic, and she got some stimulants. She got some speed to help her lose weight, phentermine. There's no real good evidence that phentermine is a valuable tool there. In fact, it plays with the emotions and causes other problems. There are better ways to do that. And so why would you medicate when actually changing other behaviors is more important? And so looking at that 4-minute visit, the doctor doesn't really have a lot of time there, and they're not really good at writing a specific physical therapy or personal training prescription or a specific dietary and or lifestyle change prescription. You need to cut back on your calories. Is not going to be an effective way of coaching any individual to change their lifestyle or their behavior to effectively lose and maintain weight loss. There's no way it's going to happen, because the patient's going to say, how do I cut back the calories? And the doctor's already out the door. Because the doctor's specialty isn't planning and coaching someone through a nutritional change.
Yeah.
And their specialty is not setting up an exercise routine.
And
so
there's a lot
for
of
that
new
person.
information. It takes a lot of learning, and you need someone, a coach, to rely on.
Right, right. So health coaches are another good modality that I think we're going to see more and more in practices in the future, because they really help people do the things they need to do to get and stay well.
So we have a special seminar coming up with you called Ask the Doc Series. It's going to be on April 19th from 5 to 6:30 in the evening, right after work, at Comfort Keepers Comfort Center at 3619 Beneva Road. Tell us a little bit about the collaborative care presentation. We're going to be talking about who's going to be there and what people are going to get out of it.
Right, so I'll be talking a bit about the concept of collaborative care, and then I'll have my functional dietitian, Paulette Weber. She will talk with us for a few minutes, and a behavioral therapist will also be there, Andrea Feldmar. She used to be the director at the Center for Building Hope, or what was the wellness community. So she's very skilled at dealing with people who have very profound medical challenges and helping them navigate the mood disorders that come from these challenges.
And I'll be talking about how home care fits into and coordinating with the things that go on that we see in the home, and how we can relay it back
and
to
that's
your
another
to your doctor.
collaborator. The home care is a big part of it.
So April 19th, be there. It's going to be a great seminar. You get your questions answered and how to pull all the pieces together and work with some modalities that you may not even know exist. So we thank you for watching. We'll see you again next week. Have a great holiday.
Comfort keepers, 'cause there's no place quite like home. Call Comfort Keepers.